Hello and welcome to this recorded presentation for the employees of Green Guard Services for the Employee Benefits Program beginning July 1st, 2023. My name is Bill Hammett. I am proud to be your insurance expert. Me and the two staff members that are assigned to your group are here to help you anytime during the year. I can be especially a good resource for you during this open enrollment period should you have questions about the differences in the plans, what's best for you and your family, helping understanding the terminology or how these plans work. Throughout the year, Rhiannon and Anna can be there for you for missing ID cards, finding doctors, claims issues, but whatever it is that you need throughout the year, we are here for you. Quick agenda of our open enrollment presentation. We'll talk about the timeline of open enrollment, the medical plans available. We'll go through the enrollment portal real quickly. And then, of course, if you have any questions, if you need any answers, we're here for you. So Monday, May 22nd is the start of open enrollment. It goes for 1 week to May 29th. If there is any extenuating circumstances, if there's anything else going on in your life where you need a little more time, please reach out to me as soon as you can. I would love to help with that particular issue, any questions you have that you need answered so you can make a good decision. Again, reach out to me. This is the time of year where those of you that are enrolled can change plans. You can add a dependent, remove a dependent, whatever it may be. For those of you that have maybe elected not to enroll in benefits in previous years, this is open enrollment. This is the time to join the plan. Any changes you make will be effective July 1st, 2023. We're asking that everybody do everything they can to make sure that all enrollment is complete by Monday, May 29th, and you'll be completing all of your applications online at the EASE Benefit Enrollment Portal, which we'll go through. So we have 9 health insurance plans. We have a really great spread of different options through a company called California Choice. This company, California Choice, brings together Anthem Blue Cross for our PPO plans. For the San Diego and Riverside areas, there is the Sharp Health Plan, HMO, and for everybody in California, there is the Kaiser HMO plans. We have 5 HMO plans from Kaiser, 2 from Sharp, and 2 from Anthem Blue Cross in the PPO field. So let's talk about our benefits real quick. Here we have our silver plans, and what I'm going to do here is I'm going to kind of go through one of our most popular plans, the Silver HMO A plan, right here in the middle. I'm going to go over all these plans and this plan in some detail, give you an idea of what some of this terminology means so that you can understand what you're looking at. So we'll start here at the top. Deductible, $2,300. A deductible is, generally speaking, what insurance companies say you must pay all of this number before they start to pay anything. So a deductible of $2,300 means that you could be on the hook for the first $2,300 of expenses. Notice, train your eye here to where you see the term DED waived. You see this throughout the spreadsheet here, DED waived. This means deductible waived. So if you are to join this Silver HMOA plan from Kaiser and you need to see a doctor, we see our office visits here, $65 for a regular doctor visit, $100 for a specialist, deductible waived. This is good. This means that if you have this Silver HMOA plan, you can go see a doctor for $65. You do not need to pay the first $2,300 to see a doctor for a copay. Same thing with the specialist. They waive the deductible, meaning you just pay the copay. Lab and x-ray, so blood work is lab work, diagnostic lab, x-ray. $30 copay for blood work, diagnostic labs, $75 for x-rays, deductible waived. A little bit further down here, we have a $65 copay deductible waive for rehabilitation or habilitation. So this is physical therapy, occupational therapy, speech therapy, $65 copay deductible waived. Chiropractic, $15 deductible waived. All right. All the way down here at the bottom, we have urgent care, $65 deductible waived. So this is really important because a lot of people see a $2,300 deductible and say, well, man, I don't even spend that kind of money on all year for all my healthcare needs, including doctor visits and prescription drugs. Oh, no. So what I want you to know is that for regular doctor visits, specialist, diagnostic lab, x-ray, physical therapy, occupational therapy, speech therapy, chiropractic, generic drugs, urgent care, all of those benefits you will get prior to meeting your deductible. You do not need to meet the $2,300 deductible to get those benefits first. Now, then when does it come into effect? When do we see this happen? So wherever you see after DED, this means that if I need an MRI, a CAT scan, a PET scan, an MRI, I'm going to have to pay 100% of the cost of that particular service until I hit my $2,300 deductible. After I met my $2,300 deductible, an MRI cost me just $400. All right. Speaking of this deductible, this is a rolling calendar year deductible. That's important. That means, say you do need to go get an MRI. Let's say an MRI costs $500 and you haven't met your deductible yet. You pay your $500 for the MRI. That means now that you've paid $500 towards your $2,300. So you only have $1,800 left on the year for your deductible. For those of you that are already enrolled in the plan and we're switching to this new plan year July 1st, whatever you've spent towards your Kaiser deductible will go towards this new Kaiser deductible. So sometimes the deductibles change a little bit. If you've spent money towards your deductible already in 2023 and you keep the same insurance company, so Kaiser to Kaiser, then they are going to let you roll forward whatever you've paid towards your deductible from January through June 30th. So then we have our out-of-pocket maximum on this plan, $8,750. All right, what's the difference between a deductible and an out-of-pocket maximum? A deductible is something like we talked about that you would pay 100% of the cost up to that number. After that number, then you only pay parts of the cost. This is called co-insurance. Co meaning you pay some, Kaiser pays some. So you would continue to pay for co-pays, for prescriptions, everything until you have spent a total of $8,750 on the calendar year, so January 1st to December 31st. Once you have spent $8,750, then Kaiser pays 100% of the cost for doctor visits, prescription drugs, hospital stays, emergency room, lab work, x-rays, MRIs. Once you hit your out-of-pocket maximum, you are covered at 100% for the rest of the year. All right, so that's important to note, and we'll show you a real life example of that here shortly. All the way down here, you see some of the big ticket items: hospital stays, outpatient surgery, emergency room visits. They say 45% after deductible. So what this means is if I'm on this plan here, I'm going to pay, if I have a hospital stay, I get in a car accident, it's a $100,000 bill, I would pay 100% of the first $2,300. Then I pay 45% of the cost. Kaiser pays 55% of the cost until my 2,300 plus my 45% equals $8,750, at which point I pay zero and Kaiser pays 100%. Okay, so that's very important to note. If I had already had that $500 MRI, right? I had that $500 MRI example we talked about earlier. I would pay 100% of the $1,800 left, and then 45% until my total cost equals $8,750. This $8,750 is inclusive, meaning it includes your doctor visit, copay, specialist, lab, x-ray, rehabilitation, chiro, prescription drugs, urgent care. Every dollar you spend is going towards your $8,750. So if you have one doctor visit and you spend $65, now you only have $8,685 left of your out-of-pocket maximum to hit. All right, so this is why this out-of-pocket maximum number is very important. Last two things here, you see the family number is double for both of these, and you see the word embedded. So those of you with families on your plan, or just a spouse or just a child, this means that you have basically two $2,300 deductibles and two $8,750 out-of-pocket maximums. The word embedded means that no one person in the family unit pays any more than their individual deductible. All right, so back to my car accident example, if I have me, my wife, and 3 kids on this plan, and I have that $100,000 problem, I have met my deductible in full at $2,300, even though I have the family deductible of $4,600. I've met my deductible in full at $2,300, and I pay 45% until I hit my $8,750, and then I am covered 100% for the rest of the calendar year, and my family has the other half of the embedded deductible. Embedded just means there's two, really. Just think of it like that. And then my family has the other $87.50 of the out-of-pocket maximum. So think if it's a good thing for us, there's a specific maximum. No one person in the family has to hit any more than their individual deductible of $2,300. No one person in a family spends any more than $87.50 on the year. And if the whole family was in that same car accident and all of us had $100,000 problems, we would have collectively met our deductible in full at $4,600 and our out-of-pocket at $17,500. Last thing here on prescription drugs, there's a separate deductible, a $500 individual deductible, $1,000 family deductible. This works the same way. So if it's me and my wife and 3 kids, there's 2 brand name drug deductibles. Notice this only applies to tiers 2 through 4. With Kaiser, there's really only 2 tiers. There's tier 1 and tier 2. There's brand name and generic drugs. So with this plan, you do not have to pay the $500 deductible for prescription drugs that are generic. You pay the $20 right off the bat. If you needed to get a brand name drug, you would pay 100% of the cost up to $500, after which you would pay only a $100 copay. All right. And again, this $500 is going towards your maximum out of pocket. So you see these other plans are a little bit different in some ways. You see this Sharp plan makes you pay your deductible first before you get diagnostic lab and x-ray covered. It doesn't cover the chiropractic care. The prescription drug benefit's a little better in some ways. So you see there's differences across the board here that are important to note. So let's look at our gold plans. Right off the bat, you'll notice that these deductibles are much lower. All right. The copays are lower. This Sharp plan has no deductible, so you're never paying 100%. All right. Our Kaiser Gold B plan, another very popular plan, has a $250 deductible. It's very, very low. What I want to call your attention to most with these gold level plans is when it comes to inpatient hospital services, outpatient surgery, and emergency room. Notice it's not percentages like we had on the previous plans. Rather, it's flat dollar copays. So if we take this Kaiser Gold B plan, one of our second most popular plans, if I stay at the hospital, after I pay my $250 deductible, I would pay just a flat dollar copay of $600 for day 1, day 2, day 3, day 4, day 5. So just $600 per day. Once I've been there for 5 days, I no longer am asked to pay that copay. I don't pay any copay for the remainder of that particular stay. All right. This $600, this copay you're paying, pays for room and board. It pays for the room. It pays for the machines. It pays for the nurses to come see you. All those kinds of stuff, the food that you get, all of that. It does not necessarily cover if they wheel you out of there and do MRIs and scans and a surgery and stuff like that. That's where you have these other costs. So again, if you did labs, you pay $35. If you had a MRI, you'd pay $250. Surgery, if you needed a surgery, it's $335. So that's a much lower cost there. And then emergency room visits, $250 copay. For those of you that have predictable medical expenses, maybe you're having a baby, maybe you need knee surgery, something like that. If you know you're going to have these big ticket items, I really think you should look at these gold level plans, as they will protect you against the big expense. So yes, the gold is going to cost you more out of your paycheck, but if you have a baby, if you have knee surgery on one of these silver plans, you might save $20 or $30 or $40 a paycheck, but when you go to use it, it's going to cost you thousands more dollars. Okay, so if you have a hospital stay with this silver plan, it's $2,300 plus 45%. Whereas with this Kaiser Gold B plan, $250 plus $600 a day. Okay, and $250 you only pay one time. So these gold plans are very competitive for those of you that know you're going to use your plans. Here we have our 2 PPO plans from Blue Cross, and then on the far right we have a bronze. This is an HMO plan. This is our bronze level Kaiser plan. This is the lowest cost plan that's going to be available to you. It's very attractive because of that price, but please beware, they have a $6,300 deductible. So you're out of pocket a lot when it comes to hospital stays, when it comes to really anything. You're out of pocket a big number there. So $6,300. It does give you 3 doctor visits. And it's any combination of doctor visit, regular doctor visit, specialist, or urgent care. So it's all combined. So if you have 3 regular doctor visits, you've used up all 3. If you have 1 regular doctor visit, 1 specialist, 1 urgent care, there you go. There's your 3. So this bronze plan is really good because it's low cost. It's dangerous though, because if you need to use it for really anything, you're out of pocket a lot. It's going to feel like you don't have any insurance plan. So just beware of that. If you don't use your health plan much, this could be a good option for you. Our 2 PPO plans, these are going to be the most expensive plans for you. These are good for those of you that want a lot of choice of doctors that you can go see, that want, maybe you have a family and you have very different providers you want to see that are not in HMO networks or in much different HMO networks. The PPO plans are going to give you tons of choice, tons of freedom. You don't need to pick a primary care doctor, none of that kind of stuff, but you're going to pay for it, okay? And you see how these plans look very similar in terms of deductibles and co-pays and stuff like that. The biggest difference is going to be the network of providers you can go see. With PPO plans, you can see so many more providers, but again, it costs a lot more. Our medical plans, all 3 of them, Kaiser, Anthem, and Sharp, all have mobile phone apps. Once you get your insurance, once you get your ID card, I strongly recommend that you download the smartphone app. You log on to their individual websites and you register online. You download the app. You have it on your phone. Once you have these apps on your phone, it is the single most important thing you can do to improve your benefit experience. So if you with these apps, you can look up claims, you can schedule doctor visits, you can actually have video visits over the phone. All of these things happen right there on your phone. So please, I encourage you to download that app. All right, now let's talk about enrollment. All of you are going to get an email that's going to lead you to this website here. It's greenguard.ease.com. If you've logged in before, you're welcome to go straight to this site and put in your username and password. For those of you that have never logged in before, that have never been a part of this, you're going to get an email. You're going to need to click the link in that email that'll take you to this site. You'll create a username and password. And then once you do that, you'll get into the enrollment portal, which will look just like this. It'll show you if you were enrolled before, what you chose before. There's a big green start enrollment button at the top right. Once you do that, you'll be led to this page where it shows you, kind of what to expect. You'll hit start. You go to this overview page where this recorded video will be embedded. You'll hit continue. You'll list all of your personal information here. Make sure to keep an eye on all these asterisks here. This is what you have to include. And then adding dependents. If you have dependents, make sure you add them in here. If you add them here, it does not mean that you have to enroll them. It just means that they are in the system so that you can see how much it might cost. Once you've done that, you'll go through, it'll ask you a couple more questions about Medicare. You'll just say no, unless you are on Medicare. Remember, Medicare is the product for seniors, 65 and older. Then you get to your medical plan. So if you've never been to this page yet, all of this is going to be gray. Nothing will be checked, nothing will be X'd. It's asking you to specify your coverage. You must hit the check mark and turn it green to be able to choose to enroll in anything. For those of you that are enrolling, both you and your dependents, you'll hit the check marks for them. Anybody you want to waive, you'll hit the X. It's not a problem at all. It's going to ask why and what's going on. Why are you waiving coverage? You can indicate why. This drop-down's got a lot of different options, including, other, where you can write none of your business or do not want or too expensive or whatever it may be. But make sure you do that. If you do not check a box here, once you get down the page, you'll scroll down the page, you're not going to see any of these green boxes to select, all right? If you've already been enrolled, you'll notice that your plan is already pre-selected, all right? So it's for those of you that are already enrolled and want to keep the same thing, this should be a very quick process for you. Notice all you do is hit the select button, and once you do, on the far right here, your per paycheck cost will be shown to you right here, and it's on a per 48 times per paycheck. Each one of this blue writing are links where you can open up either PDFs or be taken directly to websites to find doctors. Lots of helpful information here. One thing to note is the summary of benefits and coverage is a mandatory document that you must open per Obamacare. So that is going to mandate that you open this. If you don't later on before you sign, you'll be prompted to come back and open it. All right. Once you pick your plan, you're going to go to the next page with the benefit summary, which you'll see what it is, what I enrolled in. Yep, continue. You'll be taken to the sign form page. Now, right here, if you didn't open up this summary of benefits and coverages, and open it is just clicking it and opening it and closing it, works for us. If you didn't do that, it's going to prompt you to go back and open that. In the little, hey, you missed this part, there is an actual hyperlink right there. You can open it right from there. Once you've completed that task, you will be brought here to sign your forms. You'll click sign forms here. You'll write your signature. This is just like DocuSign. You'll type your signature real quick. You'll use your mouse to make your signature here. You'll hit next. Once you do that, you'll just go through the process. It's going to take you through here. You're just going to click the green boxes all the way through until you're complete. Once you're done with that, at the very top right, it's going to give you a little button that says finish. You must hit that. Once you do, you will get an email shortly, moments later, that says thank you for submitting your benefit elections. You're all done, and then you're all done. So next step, you're going to be looking for an email invitation to log into the EASE benefit portal. We're asking that everybody finish this up by Monday, May 29th. If you have any questions or if you need any answers, I'm available to you all through the year, as is my staff. I will also be on site on the 22nd to do open enrollment meetings. I'm happy to sit with anybody and answer any questions then. But again, if you miss me there, or if you have questions after we're done with that meeting, or even through the year, I encourage you to reach out to me via phone, via email, or anybody else assigned to your case. We'd be happy to help. Thank you so much for your time. It's a pleasure working with you. It's an honor, and I look forward to talking to all of you. Thank you.